Good morning everyone. How are you all today? I hope you had a very good weekend. I'm sorry for being late. I was little bit late because I forgot to put my presentation as an attachment. So I'll just give you all an introduction. Then by that time I'll get my presentation and I will go with it. Okay. Today we are going to discuss a very important topic, which is primary health care. You all know what type of care do we give at our hospital? Do you all know that it is a specialist care? This is a tertiary hospital. So today why we want to talk about primary health care? All of you know that 80% of the diseases can be cured or can be treated at primary health center. So the primary health care is very, very important. From the exam point of view, you can get a short note on principles of primary health care. You can get a long question on what primary health care is, what are the elements of primary health care. And in the Viva, they are going to ask you all about the primary health care definition as well as the elements as well as the principles. So let's talk now about the primary health care. Why this primary health care was thought of? You know, like when you look at global level, nearly 2/3 of the people do not have access to basic health services, essential health care services. What is essential health care services? We will look into it. Okay, because of that, and nearly around 50% of the people spend the money out of pocket. That is a catastrophic effect. When they spend the money on basic health services, they go into poverty, because you all know that most of the people in developing countries, especially like India and others, they are in the rural areas, and 30% of them are below poverty line. That's the importance of why this was thought of. So in the year 1978, there was a conference at USSR that was called as Alma Ata Declaration. In the Alma Ata Declaration, it was decided that everyone in the world, all the member states, agreed that they have to be provided with, irrespective of the age of the population, they should be provided with the essential health services. So it was there in the Alma Ata Declaration, the primary health care concept was evolved, and in that concept the member states, all the member states of the United Nations, they have signed in and they have agreed to the provision of basic or essential health services to our population through primary health care. So what is primary health care? So when we look at the definition of primary health care, it is the essential health care. What is essential health care? Essential health care is when you get like common cold, when you get fever, when you have when a woman is pregnant. Like it is physiological, pregnancy is physiological, but they have to be taken care of. These are the services which are called essential services. So by definition, primary health care is defined as essential health services which are accessible. What do we mean by accessible? They don't have to walk very far for the services. It should be within their reach. That is called accessibility. And once we provide a service, it should also be acceptable. Our population should accept the services which we provide. So, if it has to be acceptable, what do you want them to do? You want them to make as a partner. in our planning. So, community participation. This is also one of the important things in the definition. Why I am stressing about the keywords of the definition is, if you remember the keywords, I think it is very easy to define. I hope it is clear to you all. So, then after the acceptability comes the affordability. What do you mean by affordable? Affordability means the people, they must be affordable to take a service, to avail a service. So it's not only affordability of the population, community, even the country should be affordable. Like in a country like ours, India, we cannot think of very sophisticated equipment, sophisticated labs and all. So it should be affordable to our country. That is the definition of primary health care. I again reinforce the definition because it's very, very important from the point of not only examination but even in the viva they ask it. So it is defined as the essential services which are accessible, acceptable, affordable, and wherein the community participates. Just a second. I stop. Okay.
It's in the desktop or laptop?
It's in the laptop, in the D drive. Backup అని చెప్పరా? You just tell him backup లో ఉందని చెప్పండి.
Okay.
Sorry, yeah. So by definition, I was telling you all about the community participation and affordable by the people and by the country in which it is implemented. This is the definition of primary health care. So is it clear to you all? I hope it is clear to you all. Then comes the most important aspect of primary health care. What is the principles? There are 4 principles of primary health care. Once I get my PowerPoint presentation, I will put it to you all, and again I will go through the slides. Till that time, just be with me, and whenever you have doubts, I don't know whether you can chat with me because I am also new. Actually, I had to introduce myself. I could not do that. I'll do in my next class because I was a little bit late. Okay. So, what are the principles of primary health care? The 4 important principles of primary health care are: one is it should be accessible, I was telling you all, and then affordability and all those things. They are only the same principles, but there are also other things like intersectorial coordination and then appropriate technology. What do you mean by intersectorial coordination? When you look at the health is not only just providing a medical services. If a person has to be healthy, he has to be actually all other departments have to get involved. You want to provide healthy food, that is agriculture department, and then if the infants are there, then milk, then which department has to be involved? It is the animal husbandry. In that way, similar way, all the other departments which are connected with the health have to be coordinated. That is called intersectorial coordination. And next is the appropriate technology. What is appropriate technology? When you look at the developed countries, they have very sophisticated tertiary care. But like countries like us, like developing countries, India, when you take, we want to have a very appropriate technology which is cost effective and it should be affordable by all. I'll give a very small example. Whenever a child is having diarrhea, under 5 years old child who has diarrhea, now what happens? When we take to a tertiary care, they give IV fluids, which is not required. Around 95% of the children, they just need ORT, that is oral rehydration therapy. So the ORS packets, there are some, because with diarrhea, what happens? The child loses more of salts minerals and fluid. So to replace that, we don't need IV fluids in 95% of them. What do we need? We just need ORS packets. The ORS packets are the oral rehydration salts, which have to be just given to the child who suffers with diarrhea, and we can prevent both dehydration and death due to dehydration. So this is more appropriate technology. And next comes the other important principle is equity. What is equity? Equatorial distribution. When we all look at our health services, most of the health services are confined to the cities and towns. But it is 70% of the population which lives in rural areas. In the rural areas, if we want the health services to be available, we have to ensure that it should be equally distributed in the rural area. Not all the these health services, hospitals are confined in the city. It cannot work like that, because our population is in the rural areas, and once the hospitals are set up in the cities and the towns, it is very difficult for the people from rural areas to access those services. And not only that, because it is a tertiary care, it is very expensive. So one of the important principles of primary health care is equatorial equity, that is, it should be distributed equally. And then the other important principle is community participation, which I already stressed it during the definition of primary health care. Just a second. File name అదే సెకండ్ ఇయర్ MBBS అని ఉంది. In the backup it is there. Oh, come on, I will tell you. I forgot. ఇది కమ్యూనిటీ మెడిసిన్ అని CM అని ఉంది, అయితే UG అని ఉంది. I think they will. You can just speak. బిటు అది ఏమని ఉందంటే CM అని ఉంది, CM అనేసి అండర్స్కోర్ ఉండి UG అని ఉండేసి అందులో మళ్ళీ ఆ ఫోల్డర్లో ఉన్నాయి చూడు, లాస్ట్ ఒకటి కనిపిస్తుంది. సెకండ్ ఇయర్ ఇవాళకి డేట్ ఉంది చూడు నాన్న. డెస్క్టాప్ కాదు, యూ హ్యావ్ టు గో టు బ్యాకప్. నా బ్యాకప్ ఫైల్స్లో పోయి దెన్ యూ హ్యావ్ టు ఓపెన్ CM అంటే కమ్యూనిటీ మెడిసిన్ అండర్స్కోర్ UG అని ఉంది, అప్పుడు దాంట్లో ఉంటుంది చూడు. ఇట్ పాసిబుల్ అదర్వైజ్ బ్యాకప్. So community participation, I already told you all about community participation in my definition. I think it is very clear to you all. So what are the important principles of primary health care? One is equity, the other is community participation, appropriate technology, and then intersectorial coordination. Next, let's come to very other important aspect of primary health care, that is elements of the primary health care. What are the elements of the primary health care? There are 8 elements of the primary health care. There are 8 elements of the primary health care. Let's start with the first element of the primary health care, that is about food supply, that is nutrition. We have to ensure that all the population are given adequate food. It should be available, because the nutrients are through the food which we eat. So that is one important element. The other elements are like water and basic sanitation. You all know that when you look at the world figures, around 50% of the population do not have access to basic sanitation. What is basic sanitation? The basic sanitation is lack of toilets at their homes or in the area in their place of residence. So 50% do not have it. So it is one of the important elements of the primary health care to ensure that the basic sanitation is provided to the population. And of course, you all know about the water supply. Safe water plays a very important role in the health. So we have to ensure that the whole population are provided with safe water. So safe water supply is one of the important elements. Water and sanitation is one of the important elements of primary health care. Next important element is the maternal and child health. Maternal and child health also includes family planning. What is maternal and child health? It will start from pregnancy. Once the woman is pregnant, and then after the pregnancy, she has to have regular antenatal checkups, and then we should ensure that she will have a safe delivery and her baby is healthy. That is just in a gist I am telling about what maternal and child health means. And then in addition to another component of maternal and child health is family planning. So a couple who volunteers and likes to undergo a family planning, or they want to use any contraceptive, that is included in maternal and child health. So it is one of the other important components of elements of this primary health care. So there are 8 elements of the primary health care. Actually, I have 4 classes given for primary health care. I will be continuing all this for the remaining 3 classes. I think so you all don't have to get worried, because even though I don't have the presentation, next time I will ensure that I will be showing you all the slides pertaining to the primary health care. So the elements which includes control of locally endemic diseases. What is endemic? By definition, endemic means that the diseases which are present throughout the year. Tell me any one disease which you know that it is present throughout the year. Okay, I will tell you all. A disease is there throughout the year in our place? Yes, it is there. So it is one of the endemic diseases. So another element of primary health care is to control the locally endemic diseases. So what all did we cover? We have covered the supply, water and sanitation, and then we also covered the maternal and child health. Then we also have taken care of treatment of the locally endemic diseases. Then other things are also there, like treatment of other communicable diseases. The communicable diseases, again, you all know what are the communicable diseases which are prevalent in our country. They are mainly vector-borne diseases, waterborne diseases. Now at present, what is the disease which we are facing as a pandemic? It is the COVID-19 disease. Okay, that is also a communicable disease. That's why we all are taking care to put on the mask and ensure that we don't transmit the disease to the other people, you know. So that is also another important thing. Then how is this primary health care set up in India? Let's start with our Indian scenario. In India, when you look at the primary health care, our health services start from the village level. At the village level, we have 3-tier system. When you look at the healthcare delivery system in India, it is a 3-tier system. At the village level, we have like primary health care. At the secondary level, at district level, we have the district hospitals, and at the tertiary level, we have the teaching hospitals. So at the village level, we have sub-centers. What is a sub-center? A sub-center is a point of care wherein we have multi-purpose health workers. The multi-purpose health workers are positioned at sub-center. We have two multi-purpose health workers. One is male and the other is female. How much population is covered by a sub-center? Each sub-center covers a population of 5,000. So these sub-centers are situated at the village level. There we do not have a medical officer. Usually this question is asked in the Viva, and the examiner asks you all, where is the sub-center? And the next question is, then you say, who all are there at sub-center? Most of the students answer that there is a doctor at sub-center. No, doctor is not available at the sub-center. The doctor is available at the primary health center. So it is the first point of contact with the health service because the doctor is available. So what is the first point of contact for a health service? It is where the doctor is positioned. It is the primary health center. So the primary health center covers a population of 30,000. Means how many sub-centers? 6 sub-centers are covered by each primary health center. In the primary health center, we have, in addition to our other staff, supporting staff, a medical officer. So what are the services which are provided at sub-center? At sub-center, because the multipurpose health worker is there, she usually treats the minor elements. And then what does she do? She registers pregnant women. She also gives antenatal care. She will check the blood pressure of the pregnant women. She takes the height and weight if the pregnant woman comes for the first time. And then she registers. She gives her a antenatal card. And then she will, after doing a physical examination, after checking her blood pressure, height, weight, then she does a local examination, and then she will see whether that woman is if there is any risk factor in that pregnant woman. If there is a risk factor, her duty is to refer to the primary health center wherein there is a doctor. So doctor is positioned at primary health center. And in addition to doctor, who else are there in the primary health center? There is a lab technician. What for a lab technician? Once I tell you about a lab technician, you all should I think you all got it, that there will be a laboratory. But the laboratory, does it do all the tests? No, it does only the basic tests like hemoglobin, urine examination, and then random blood sugar, then VDRL. Why do we do VDRL? We have to do to rule out syphilis. What is the impact of syphilis on pregnancy? I think you will learn it in your OBG. I don't have to tell you all, but it is our prime duty to ensure that the pregnant woman is not suffering from syphilis. So we do VDRL to rule out. In addition to what are the other investigations which are done at primary health center? Can you all think of it? It is the blood grouping and RH typing. Again, this part you will learn in your OBG, because RH incompatibility, I think you were told a bit in pathology. I do not know whether it was covered or not, but RH incompatibility is very, very important because of the if we do not check for incompatibility, we cannot provide a service to the pregnant women. So all these basic tests like urine examination to rule out diabetes as well as pregnancy induced hypertension, and then hemoglobin, then your random blood sugar to rule out diabetes, and then your VDRL, then the RH blood grouping and RH. Why do you want to know about the blood group of a pregnant woman? It's very important. you all make note that 70% of the pregnant women, they suffer from anemia. So anemia, because of the anemia complicating pregnancy, they die during pregnancy, during delivery and in postpartum. We want to prevent maternal death. That's why we want to screen them during pregnancy and see that they are given, we want to give the treatment if they are suffering from anemia during pregnancy and then prevent the deaths, the maternal deaths. So that is another important aspect of the setting of laboratory at primary health center. In addition to that, who else will be there in this primary health center? There are also some supervisors. We have an one dot center that you all will be learning later, but that is one very important thing, that is to take care of our patients who are suffering with tuberculosis. If a person comes with any symptom of cough for more than 15 days, our duty is to check the sputum whether he or she is positive for Mycobacterium tuberculosis. So once he or she is diagnosed, the treatment is started at the primary health center and then handed over to the this sub center, because the follow up is done from the sub center level. So how does the primary health center help? The primary health center not only diagnoses, it also helps in follow up. If we send, it is two sides. We refer the cases to the higher center. After the higher centers, they diagnose, treat it, they again come back to us and again go to the community and we follow them up. So primary health center plays a very, very important role in the healthcare system. So then let's see what does the doctor do in a primary health center. The first thing, as soon as he comes, what do you all see in this hospital? We all talk about OP. OP is nothing but outpatient treatment. So the OP is run by the medical officer of the primary health center, the outpatient services. So outpatient is very important because once the patients come to the primary health center, they have to be diagnosed and they have to be given treatment. So outpatient services is very important, which are provided by the doctor. In not only outpatient services are provided by doctor, we have 6 beds in a primary health center. Why do we want to have beds in a primary health center? You all may get doubt. Yes, it's very important because we have to provide them emergency service. Like on the way, somebody can have an accident. We had to provide an first aid. We had to make them, there should be this bed. The patient may need or the victim may need IV fluids. All those things. For that, the government has sanctioned 6 beds in a primary health center. Did you all go to primary health center during your visits? If you haven't gone, then I think they will arrange, you don't have to worry. But these are the things which you have to look into it, so that it will give an insight to you all how a primary health center works, and all your questions are mainly based around primary health center, because it is the primary health care which is required and for our population, and then it is very, very important to achieve all the goals. About the goals, millennium goals, sustained developmental goals, all those things I will be covering. I am given 4 classes in the primary health care, so I will be covering all those things. Today I want to talk a very basic thing. I want to tell you all how the system works and exactly what primary health care is, how it is provided, and how we want to achieve our given goals. Okay? Then I think I will stop here. If you have any doubts, I don't know, you have to chat with me. ఎక్కడుంటుందమ్మా పాప? అందుకే 1 minute పెట్టిన వాళ్ళకి టైం అలా ఒక 1 minute పెట్టిన చాటింగ్ ఎక్కడన్నా ఉంటుందా అని.
I'm just saying on here you can see more clearly.
అవునా?
They will chat here also. You can just tell them if they have any doubts they can chat in there. Keep it in the chat.
I see you. అచ్చా ఎక్కడ?
You can just tell them if they have any doubts they can chat here. But when we end the class, this will be gone.
ఎండ్ అయిపోయింది కదా, 15 అయింది, వేరే వాళ్ళు వస్తారేమో అని. ఐ డోంట్ వాంట్ టు టేక్ దేర్ టైం.
Okay, fine. So I'll stop.
Just ask them.
No, I'll stop stream. I'll stop the class.
You stop.
Okay.
I want to see whether they have any doubts. How to see?
That we have to
ఉండదా?
mail.
I must see my mail.
Yes.
నా మెయిల్ వాళ్ళకి తెలుసా?
That's what we have to tell them to. If they have any doubts.
You just stop it. I will then